Hi, today we are going to talk about diabetes and how to be free from diabetes. In the world today, about 67 million persons die yearly all over the world. And among these 67 million persons that die, is either it is non-communicable diseases that kill them or communicable diseases that kill them. But among these, 70% of them die from non-communicable disease, of which diabetes is one of them. And today, I'm going to tell you how you can detect if diabetes is on the way coming to you. What do I mean? About 500 million persons all over the world today are living with diabetes. That is, they have diabetes and are taking one form of medication or the other for diabetes. Diabetes is a disease that is not curable, but it can be controlled and well managed in the hands of medical specialists. But before diabetes comes, there is a period between 5 to 10 years that it will be in your body without showing any sign. It is at this period, at this point, that you can be able to detect it and prevent it from coming. This period is called pre-diabetic period. And how do you know this pre-diabetic period? You will do a particular single test that will help you and dictate if you have diabetes or not. But before I go into that, I will tell you if you are at risk of having this diabetes in your body. Despite the 500 million persons that have diabetes, another 500 million will likely develop diabetes in the next 5 to 10 years. In fact, it is estimated that by the year 2050, more than 1.2 billion persons will have diabetes all over the world. And that is very expensive to maintain. And it gives a lot of mortality and morbidity. But on today's video, I am going to tell you, and you will find out by yourself, if you have diabetes and if you have diabetes incubating in your body. Now, there are 10 points I'm going to give you. If you follow any of them, you will realize that you may be among the persons that will develop diabetes in the next 5 to 10 years. What are those things? Are you above 40 years? You are at risk. Do you have obesity? You are at risk. Do you have sedentary lifestyle? That is, you sit down more than 4 hours in a day? You are at risk. Do you exercise up to 3 to 5 times in a week? You are at risk. What I mean 3 to 5 times in a week, or you put in 75 to 150 minutes of exercise in a week. If you don't do that, you are at risk of developing diabetes and pre-diabetes. Do you have any first degree relative that has diabetes? That is your mother, father, brother, or any of your siblings that have diabetes? You are at risk. Do you have, for female, did you give birth to a child that is weighing more than 4 kg at birth? You are at risk. Did you have, for women, did you have diabetes during pregnancy, which disappeared after pregnancy? You are at risk. For you, as an adult, when you were born, your birth weight, was it less than 2.5 kg? If it was less than that, you are at risk. Do you have high blood pressure? If you have high blood pressure, you are at risk. Diabetes has a lot of complications, ranging from heart attack to chronic leg injury to sudden death to stroke and so many other problems that diabetes can give. But those problems can be prevented if you're able to do a single test, a single lab test that is not so expensive, that will help you to detect if you may have diabetes. Do not allow diabetes to result to complications such as heart attack, such as injuries, such as stroke, and other problems, including death, quite unfortunately. But we are not talking about it. It's something that you can prevent. But before I continue, please subscribe to this station and hit the bell icon. This will enable you to get more information that we release on regular basis. Now, back to the problem of diabetes and how to prevent it. The point I am talking about is pre-diabetes. the period before diabetes come. It is a period whereby your blood sugar test has not reached up to the diabetic level and you don't have symptom, but you are interpreted that you don't have diabetes. This is the point that something can be done in order to prevent you from having diabetes. The simple test you can do at home is glucometer test. That is this blood sugar test, as you are saying. You can do it, and it will tell you quite a lot of things. This glucometer test can be read in milligram per dl or millimole per dl. The normal is 3.0 to 7.0 millimole per dl or 54 to 126 milligram per dl. Now, so many people take this to be normal, but it is not normal. The problem you can intervene is pre-diabetic period, which is 5.6 to 6.9 or 100.8 to 124.2. This is the most important point. By then, the blood sugar have not reached the diabetic level, but at this point, you can be the winner if you do what you're supposed to do to prevent and protect yourself from diabetes. There are very few things, very common things that you can do, which may not be expensive for you, but it's for you to be aware that this thing called diabetes or pre-diabetic period is occurring and gradually moving on in your body. It is going to cause high death and other morbidity level, but you need to do quite a few things in order to prevent that. Back to the risk factors. If you were born and your birth weight was less than 2.5 kg, you are at risk. I mentioned obesity earlier. Many people do not know how to calculate obesity. Obesity is not that you are just fat or you appear to be plump. No, that is not obesity. I am going to make a video that will explain how you at home can dictate if you are obese or not. But that will be a video of another day. As I said before, this channel talk about early signs of disease, warning signs of disease, many years or months before they occur in your body, and how you can prevent them. Simple things, simple measures you can do to prevent this disease from affecting or attacking you. It is a disease that we cannot be able to cure, some of them, including cancers, some of them including diabetes. But back to what we are talking about, diabetes. Diabetes is a disease that when you are very conscious of yourself, you can dictate the early signs, early symptoms of them and prevent them. Some of them may not even give signs and symptoms. They may present to the hospital as death, as stroke, as heart attack, and so many other problems. But if you are patient to watch this video to the end, you are going to find out what you are going to do by yourself. Going to hospital is not the problem. You can go to hospital when it is necessary, but by yourself, you can do quite a lot of things to protect your health, to save that money that is scarce, to save that time and that psychological problem it can develop to you and to your family. Just be patient and watch this video to the end. You will be able to get and know one or two things that you can do in order to protect and prevent yourself from having this diabetes. People can live with diabetes, but remember that diabetes has no cure, but you can defend diabetes. You can protect yourself from diabetes. Number one, what do you do? How are you going to find out if you are at risk, if you are incubating diabetes in your body? This is what we call lifestyle modification. Lifestyle modification is a form of a treatment, is a form of activities, is a form of things you can do or things you should not do to protect your life, to protect the lifetime, to increase the life scale of yourself and that of your family. Number one you have to do is you pay attention to activities. One, sedentary life. What is sedentary life? Sitting down in a place for more than 1 hour at a time, or cumulatively more than 4 hours in a day. The research has shown that people that sit down more than 4 hours in a day have increased possibility of death than those that do not sit more than 4 hours. In fact, if you sit down at a particular place for up to 7.5 hours to 10 hours in a day, continuously for a long time, research has shown that you have chances of 50% chances of death before it is your own time. So what do you do about this sedentary life? You have to, within 30 minutes to 1 hour, for one reason or the other, you have to stand up and walk around and sit down again. If you're in the office and you have bell that summon your secretary, you have to remove that bell and walk to the door and call your secretary. If you're in the office, or if you do the work that keeps you down, sitting down most of the time, you have to put hourly reminder so that you'll be able to stand up at the appropriate time and walk around and help yourself. Now, exercise. Exercise must not be active exercise. Brisk walking. What do I mean by brisk walking? You stand up, you walk with your legs, but you have to walk fast. But remember, when you do this exercise and you feel pain on your chest, you have to stop immediately because you're already having a complication or a problem that needs to be sorted out by a doctor before you continue the exercise. So what I'm saying in essence is, if you are exercising and you feel pain around the chest, you have to stop the exercise immediately and see your doctor for further advice and investigation. Now, exercise can be done by brisk walking. You walk in your environment. You can even walk in your room. You walk from one end of the room to the other end of the room for at least 30 minutes, 3 to 4 times in a week. You have done the exercise. Again, for those that smoke, smoking should stop entirely because smoke will increase the resistance of the body of insulin. It will increase insulin resistance and you have diabetes at the end of the day. Alcohol should be reduced to the level that is allowed medically. That is the topic of another day. Now, what again do you need to do? There's a lot and quite a few things that you need to do that will not cost you money. Have you done diet? Dietary advice is another point. It does not need so much money. It is the normal food that you eat in a day. Quite normal food that you eat. But count the amount of the calorie that you have to put there. You save your money, you save your time, you save your energy, you save your life. What do? In a plate of food, make sure that at least half of that plate is made up of green vegetable. There are different vegetables that are eaten across cultures. Find out the one that is most prevalent in your culture and take that. 50% of that plate, 25% of it will be made up of legumes, brown rice, beans, and other legumes. While the other 25% will also be made by lean meat, such as chicken without the back, maybe fish, or maybe other type of food that does not have a lot of fats. If you have done that, you are taking precautions for your vegetables, for your lean meat, for the legumes and brown rice. It will go a long way to help you to live and keep fit. It has not stopped, it has not come to the end, but also bear in mind that among all of them, among everything that I have said, regular medical checkup is also very important. You have to see a doctor on a regular basis. You have to make sure that you go for normal screening and you do things that will help you. But remember, the key point in this is that do the glucometer test, and if your result is more than 6.9, if it is more than 6.9, you have pre-diabetes. And if you do not do anything at the end of 5 years to 10 years, you will eventually going to have diabetes. So what do? You do the lifestyle modification as I have said. You also include exercise, diet, and no smoking, less alcohol, medical check when it is necessary. Always be health conscious. Before I continue, there are other videos that we have made on how to prevent premature death, how to do other things, how the early signs of other diseases that are very serious. So please watch those videos and remember to subscribe to this channel. This channel is the channel that will save you quite a lot of money. It will save you quite a lot of risk, and it will help you. It is a channel that will help you do things by yourself. Find out your health risk and take actions and precautions before it becomes too late. Thank you. Share this video to your friends and family, and also see the channel